Dr. Chijoke Kaduru is with us, a public health physician. Thank you for joining us on the program. Let's talk about the second wave and also the new strains. How much of a threat do you think it is, and not just in Nigeria, world over, in the fight against the pandemic?
Oh, thank you very much, Millicent. I think that we can all recognize that the data has shown us that the second strain or the variant strains that we're seeing are a bit more transmissible than the initial strains of the virus, which essentially makes them that little bit more dangerous for everyone. But I think that the ultimate realities for us are that we have to circle back to the mechanisms, the non-pharmaceutical interventions, and all the preventive guidelines that have been put out for us. Because, whether it's the first strain or it's the variant, the variant that we're dealing with, if we abide by the guidelines of, washing our hands with soap and water for the recommended time length, as well as wearing our face masks over our noses and our mouths, and maintaining the distance as much as possible, I think that puts us in a good position to be able to control this. And I think it also just highlights the even bigger need for global solidarity, because at the end of the day, if we have one infection going on in any country, none of us is ultimately safe anywhere else.
Talking about global solidarity, what do you make of the delays being experienced in vaccinating the African continent? For example, the UN Secretary General believes vaccinating the vulnerable frontline workers first would ensure equitable distribution, especially by richer countries, because then other countries can have access to the vaccines. What do you think?
I think in general, it's quite disappointing to see that, the uptake of the vaccines globally is predominantly in the high-income countries at the moment. And we will all continue to advocate for more equitable distribution and equitable access to the vaccines. But we must also recognize all of the efforts that are currently going on into pushing through with that equitable access. Efforts like what we have with the COVAX facility are instrumental to making sure that low and middle income countries, including Nigeria, would ultimately be able to access the vaccines that we need as well.
Only yesterday, we heard as well South Africa health officials saying they're pausing the country's rollout of AstraZeneca after the study showing that, it wasn't, in terms of its variant, it wasn't of much help, 22%, I believe. Looking at perhaps Nigeria and our strategy, what do you make of our choice of AstraZeneca?
So I think it's important for us to recognize that every country has a very unique outbreak going on in the country. And so, each country has to take, a look inwards and make a decision for themselves. So I think it's not generalizable, a decision that South Africa has made, and it's not going to apply. It's not a one-size-fits-all paintbrush that we're going to use to say, hey, every other country has to make that exact same choice. We have to recognize that South Africa has arguably the highest mortality from the COVID-19 virus in Africa. And that also means that their decision-making has to be different. Also, the number of cases that we've seen of the new variants in South Africa are also very different from what you have in Nigeria. What's important is that in Nigeria, the decisions are following the science, the decisions are data-backed, and they're being made in the best public health interest. And that's what really is important for all of us.
What more do you expect our approach should be, especially to selections for vaccination, the age range, the number of people with the 16 million AstraZeneca that we're expecting?
I think that there's already a country action plan that clearly prioritizes health workers in the first phase and then goes on to look at people who are elderly and above 50 years old, and ultimately people with comorbidities and then other risk groups. We have to recognize, again, that these decisions are being made with a review of the science. They're being backed by what is global best practice, what are recommendations from WHO, and also what are in-country considerations as to what makes the most sense for Nigerians across board. So I think that we have to just work with that prioritization list, because it's completely evidence-backed, and that's what will be in our ultimate best interest. You have to also remember that quite a significant proportion of health workers have been infected with COVID-19, and they are the front lines. They've been there providing care, and ultimately protecting them also ensures that the entire health system doesn't collapse. So it's important that we're prioritizing with all those kinds of thoughts and considerations in mind, right? So I think that for Nigeria, what matters is that there is a country strategy that recognizes all of the global best practices and what is in the best public health good.
We appreciate your time. Thank you so much, Dr. Chijoke Kaduru, public health physician. Thank you for joining us on the program.
All right, thank you very much, Millicent.